A few years back, a friend and I would often talk about how wonderful it would be to see again without the use of contact lenses or glasses. And we had heard about a surgery or a technique that was available, but we didn't realize that it might even be as available as it is now. I don't know if it was then, but it seemed like something almost futuristic that would be great if it could happen someday.
I could get up in the morning and I could look at my clock, I could tell you what time it is. Just get up, wash my face, and even if I'm in a grubby mood, I just put on a ball cap and some sweats and I'm off to work, or whatever I have to do. It's the best decision I've ever made.
Sometimes I had problem with the cornea scratch, and my eye color changed to red, and lots of problems, itchy, you know. Sweat goes in my eyes and it hurts. But today, I really don't have to worry about any of those pains or problems. So simple.
I went from this to this with one 15-minute surgery.
Laser power is revolutionizing the world. The advent in the 1960s of this exciting form of energy brought to medicine a marvelous tool. A tool now used routinely in many fields of medical diagnosis and treatment. This form of light energy can accomplish tasks that conventional surgery cannot, can perform treatments previously impossible. The first use of lasers in medicine was for eye surgery. Since that first operation in the 1960s, millions of people have had their vision preserved, restored, or enhanced with lasers. And now lasers are being used to give natural, clear vision to hundreds of thousands of people worldwide in just a few seconds. Until recently, people with focusing problems had no choice but to wear glasses or contact lenses. Their activities and careers were often limited by the degree of this dependence. Laser surgery offers a real solution to these refraction problems. The word refraction refers to the way light rays are bent or focused. An eye's refractive characteristics depend on the shape of the cornea, the power of the natural lens, and the length of the eyeball. When these components are coordinated, light is focused directly onto the retina and the person sees clearly. Myopia, or nearsightedness, affects more than a quarter of all people in North America. The eyeball is too long in relation to the rest of its parts, and as a result, light rays focus before they reach the retina. The image on the retina isn't clear. A less common refractive problem, hyperopia, or farsightedness, is characterized by an eyeball that's too short. Light rays haven't converged to a focal point by the time they reach the retina. The result is an unfocused image. Astigmatism is a general inability to focus clearly at any distance because the curvature of the cornea is not symmetrical. Instead of being spherical like a basketball, the cornea is shaped more like a football. Astigmatism is often combined with myopia or hyperopia. Glasses, in use for 1,000 years, and more recently contact lenses, compensate for refractive problems by adjusting the angles at which light enters the eye. They have played a tremendously important role in providing clear vision to millions of people, but they are inconvenient. Some people worry about losing their corrective lenses in an emergency situation and not being able to function.
I was unable to function without my glasses. If I went on holidays, if I did anything, I had to make sure I had an extra pair of glasses. I was basically blind as a bat. It was pretty scary. For example, at nighttime you could hear something outside. You'd have to get up and fumble for your glasses to, try and take a look outside. And by that time, usually, whatever was happening outside was gone.
First thing in the morning when you woke up, you'd be able to see the alarm clock, that type of thing. But being really active, I think that it's really difficult just to do something as normal as going out for a bike ride and not worry about having the bugs flying into your eyes and having to stop and take your contact lens out and put it back in again, something like that. That happened all the time. So that, to me, was a real bother. And even just dust and things in the air often will aggravate being able to wear contact lenses.
I played a lot of sports and I did a lot of soccer, and when my position was forward, a lot of things I had to do was head the ball all the time. By heading the ball, I couldn't even wear sports glasses because it interfered with ball hitting me in my face, chance of glasses breaking, always crashing up against my nose and stuff like that. Swimming, couldn't swim. With contact lenses, I lost a contact lens once already swimming.
Certain professions require a given standard of natural vision. Clearly, for a variety of reasons, glasses and contact lenses aren't the solution for people who want or need the freedom of naturally good vision.
My pursuit to become a police officer ended when I found out that my eyesight was way below their acceptance level. So when I found out about the gimbal eye surgery, it was a real godsend. It enabled me to be well above their standards. So now I'm able to compete and try and get on as a police officer.
My profession is teaching the aerobics always and setting up the weight training program. And one day I went, met a friend, and she mentioned to me she just had laser surgery done through Dr. Kimball, and she was highly recommended to me. And I thought about it many times, and then I made up my mind. I went, I had eye surgery done, and I'm very, very happy. It's just like a brand new person. How are you doing?
The Gimbel Eye Centers now offer real solutions to correct refractive problems through several effective surgical procedures. The Gimbel Eye Centers have been performing refractive surgery since 1984.
Thank you for calling the Gimbel Eye Center. How may I direct your call? Thank you.
A team of close to 150 professionals, including ophthalmologists, optometrists, technicians, and counselors, combine their skills with the best of technology to preserve, restore, and enhance the visual possibilities of patients in their care. Candidates for refractive surgery are examined by a doctor at the Gimbel Eye Centre to make sure their eyes are healthy and to discuss any concerns. A comprehensive series of tests determines very accurately the characteristics of each eye and the candidate's suitability for surgery. A unique option available for the convenience of highly motivated patients is same-day surgery. Patients may choose to have surgery the same day as their comprehensive tests. The origins of refractive surgery can be traced to a procedure called radial keratotomy, or RK, introduced by a Russian surgeon in the 1970s. Dr. Sviatoslav Fyodorov spent several years developing a safe and reliable method of correcting short-sightedness by making tiny cuts in the cornea. By 1978, radial keratotomy was introduced to North America, where its effective results have made it very popular. Millions of people worldwide have benefited from this procedure. The Gimbel Eye Centers have corrected thousands of eyes with radial keratotomy. People with low ranges of myopia are excellent candidates for achieving good natural vision with radial keratotomy. With RK, using a diamond blade, the surgeon makes microscopic cuts through most of the thickness of the cornea. These cuts reduce the curvature of the cornea so that light rays ideally converge to a focal point on the retina. The surgery takes only a few minutes. An eye patch is not needed, and typically the patient can go home right away. Changing the shape of the cornea with a laser beam, a newer method of corrective surgery, is the solution for most people. The technique, called photorefractive keratectomy, or PRK, uses the light energy of a laser to remove microscopic layers of tissue. This changes the curvature of the cornea and improves the focus. Over the years, many different types of laser, CO2, argon, ND-YAG, excimer, have been developed for specific medical uses. In the early 1980s, Dr. Stephen Trokel of New York noted that because of its extreme smoothness and accuracy, the excimer laser was especially suited for cornea surgery. Since then, the excimer laser has corrected hundreds of thousands of eyes. Canada's first excimer laser surgery for nearsightedness was performed in June 1990 at the Calgary Gimbel Eye Centre. Since then, the center has helped thousands of people to natural, clear vision through laser refractive surgery. The excimer laser uses a mixture of argon and fluoride gases in a mirrored tube to produce an invisible beam of light. It's called a cold beam because it doesn't burn or cut when it touches the tissue. Instead, it functions by breaking the molecular bonds between cells and vaporizing tissue, one microscopic layer at a time. The beam is computer-controlled and extremely precise, so precise it can sculpt tissue with little effect on the underlying and surrounding tissue. So precise, it can sculpt small sections of a human hair, leaving the adjacent sections untouched. When nearsighted eyes are treated, the laser removes more tissue from the central area of the cornea than from the more peripheral part. In this way, the curvature is flattened to improve focus. By modifying the area to be treated, astigmatism can be corrected at the same time. In farsighted eyes, the laser is programmed to remove more tissue from the peripheral areas than from the central area of the cornea, increasing the curvature to improve focus. In the laser suite, the selected eye is anesthetized with eye drops so that the procedure will be painless. No needles or injections are needed. The patient lies comfortably under the laser while the surgeon programs the computer which controls the laser.
You know, when you sit in the chair and the chair goes down, you're thinking, well, this is it. Even though it's been explained beforehand, it was very reassuring during the procedure. The explanation that the doctor gave me every single step of the way, from the very putting the pillow under my head and then the drops in the eyes.
The surgeon sets the laser controlling devices and verifies the candidate's eye position. Then the laser sculpts the cornea into its new shape. Total time in the laser suite is 10 to 15 minutes, but the actual laser application typically takes less than a minute.
You know, I was explained that it would take about 66 seconds for my particular surgery. And I got a countdown, and I knew where I was at the 15-second, 30-second mark. There was the cloudiness that I was told would happen. The light that I was to watch became a little blurry, but I didn't feel anything. There was no discomfort at all.
After surgery, patients wear a clear contact lens to protect the eye for 2 to 3 days. They can go home immediately after the surgery. Then, 1 to 3 days later and a few times during the next year, patients return for an eye exam. Eye drops are generally used for a few months. Functional vision will return within 3 to 4 days, and patients can go back to work and drive. Almost everyone who has refractive surgery will experience some side effects immediately after the surgery, but these usually disappear in the following weeks as the eye stabilizes. For people needing a very large amount of visual correction, a procedure called laser-assisted in situ keratomileusis, or LASIK, may be the best way to achieve clear, natural vision. This procedure had its origins in the 1960s and has evolved over the years into a safe and effective procedure. The current technique involves both the use of conventional and laser surgeries to correct nearsightedness, farsightedness, and astigmatism. In performing LASIK, the surgeon uses a special oscillating blade to make a partial cut through 1/4 to 1/3 of the front surface of the cornea, creating a flap of clear tissue on the central part of the eye. The patient is then positioned under the excimer laser, which is programmed to sculpt away some of the internal corneal tissue under the flap. After the laser has removed the selected tissue, the flap is placed back into its original position. The cornea has extraordinary natural bonding qualities that allow effective healing without the use of stitches. The entire procedure takes about 15 minutes. Patients remain awake with only the designated eye anesthetized with drops. Good vision is often possible the day following surgery.
Before the surgery, my eyes were very nearsighted. I was at -22 in both eyes, as my thick glasses will testify to you. I was no longer able to wear contact lenses due to the extreme irritation in my eyes, and I felt that I needed to do something. And the surgeries that were coming along were increasing in technology along the way, and I thought it would be a good time to do it. Before the surgery, I was really somewhat limited in a lot of respects in what I could do. Events like water skiing or a lot of aquatic activities were out of the question. I couldn't be around dust-filled environments very much due to the irritation in my eyes. Now after the surgery, I find out that I've really gained a lot of freedom. I can do a lot of things I really couldn't do easily before, and my freedom isn't really restricted in any sense. Now after the surgery, I find that I have a whole new world that's been opened up to me.
Laser surgery has revolutionized refractive eye surgery. It's quick, safe, and extremely effective, and most patients are very satisfied with the results.
First of all, the professionalism, it was fabulous. Even on my initial visit, went through numerous tests that I hadn't anticipated. It was wonderful. They're so thorough there. They want to know everything about you, and then they can obviously tell you whether or not you're a candidate for surgery. And of course gave me as much information as they could on the surgery itself. And all of a sudden it didn't seem as a very scary procedure at all. It seemed like just a great opportunity to finally have good eyesight again.
It's a lot easier to do my job. The reason being that when you wear a welding mask or some goggles, they don't fog up on you. You're outside when it's cold, and you come inside, you don't have that big thick layer of ice that builds up in your glasses, and you're blind to take them off. You're blind to leave them on, so it's a real catch-22. It's really nice being away from that.
Well, after the eye surgery, I'm very happy now, and I'm very excited, and I work harder, and it changed my life completely.
They treated me really first class. It's just like, you know, being first class in an airplane. The service was always there. I never had to feel like, oh geez, you know, should I ask this question? Do I feel stupid asking this question? It was always, do you have any more questions? Are you sure?
I was very impressed all the way along, from the first time I went to a seminar right through to my checkups, through to my surgery. Everyone treated me with a great deal of respect. They were professional, they were very friendly. Even now, 6 months after the surgery, I can still go back. Everybody knows me by name. I'm just very impressed with the service they've offered.
But what was really impressive was the day of surgery. I chose to have everything done on the same day. So the orientation in the morning, the surgery in the afternoon, and you can go home right afterwards. And I was just so impressed at how warm and how professional and so how caring the people are that work there. It's just so overwhelming almost. They really want to take care of you, and it was so nice. I really didn't worry at any time prior to surgery about the surgery. It was fabulous.
The excimer laser is truly an amazing development. Fast, precise, able to vaporize tissue in a variety of patterns, the solution to many refractive problems. See for yourself. This could be the beginning of your new life of visual freedom.